Good afternoon, everyone. Good afternoon. Thank you so much for coming. If your friends are still somewhere else, please tell them to come. This is one of the best sessions in this summit. I'm sure at the end of the entire session, you will agree with me. So, very special welcome to Beyond Health, Positioning Family Planning as a cornerstone of gender equity and social economic growth. FP 2030 is the largest global partnership focused solely on family planning. This singular focus allows us to bring together the widest possible range of partners across disciplines, sectors, situating family planning at the crossroad of the global health, development, gender equality agenda. And you would agree with me that that is why we are excited to be co-hosting this breakout session with Policy Innovation Center. We are also, as FP 2030, leading a new collective effort to highlight what family planning makes possible. This is healthy families, thriving communities, economic empowerment, and unlocking dreams. The Made Possible by FP campaign highlights how access to family planning allows girls to stay in school, parents to raise healthy children, women to land their dream jobs, and meaningfully participate in workforce. Family planning is often framed solely as a health intervention. And you would agree that once they mention family planning, methods, commodity comes to mind. But yet, its transformative potential extends far beyond individuals' well-being. We need sharper messaging, new champions, broader voices, and a united platform that speaks to shared ambitions. And we also know that the current funding landscape for family planning has been constrained by narrow perspective on what family planning is and who is benefiting. The limited view contributes to perspective that funding for family planning is unnecessary or wasteful. And I would like to just take a pause and tell you a quick story. So this is me, Margaret, and I'm able to be here because God's grace, but also family planning made it possible for me. I have two boys. When I had my first child during COVID, he needed all the time, and I was in between, what next? But because I had access to family planning, I was able to give him all the attention that he needed, get back to work, support girls at internally displaced persons camp, and continue my career. I was able to space. 3 years is a good time, right? And today, I'm able to be here because I had access to family planning. As simple as that conversation was for me and my husband, I noticed and did observe that not everyone have such conversation or even can walk into a facility to have access to family planning. So today, we are reframing family planning not just as an opportunity to create awareness, but to also position it as a critical development tool that goes beyond individual benefits, strengthening the case for sustained investment and prioritization. And today, I'm so excited to welcome our chairperson, who I believe has given me the permission to kickstart. And the interesting part is Dr. Salma Ibrahim Anas. Can we put our hands together for her? Who is the special advisor to the President on Health and the chair of the Presidential Advisory Council, that's PAC, Subcommittee on Health. She is also a member of FP 2030 board globally. Dr. Salma Ibrahim Anas is highly accomplished medical doctor and public health specialist with over 30 years of experience in health sector development. Her expertise spans sexual and reproductive health and rights, maternal, newborn, child, adolescent, and elderly health, nutrition, health promotion, and health system strengthening, with a particular emphasis on primary health care as the foundation for achieving universal health coverage and advancing the Sustainable Development Goals 2030. She has also played a key role in the design and delivery of health programs in both emergency and humanitarian setting. Over the course of her career, Dr. Anas has worked with both government institutions and leading international organizations. She is widely recognized for her leadership, innovation, and commitment to strengthen health systems. Please make welcome as she chairs this event with a very special remarks this afternoon, the special advisor to the President of the Federal Republic of Nigeria on Health. Thank you so much, Ma, and it's so...
Thank you so much, Margaret. Let me start first of all by saying a very good afternoon to everyone, the organizers, the participants that are here, and also the panelists. Good afternoon to you all. So as Margaret rightly introduced the topic, we're looking at family planning beyond health. It is a necessity for socioeconomic development and also a necessity when we talk about gender equity. We can't have it without having family planning available to everyone, including men, but most especially women, adolescents, and girls. And it should be an integral part of our sexual reproductive health and what I call the RAMCA, reproductive, maternal, newborn, and child health. Without it, we cannot attain our quest for attainment of universal healthcare coverage, where we believe no one should be left behind. So I appreciate the organizers for inviting me to chair the session. And I look forward to the session. I'm sure it's going to give us a lot of insight into what family planning is exactly beyond health. Because most people have the misconception, even healthcare providers, that family planning is a health issue. So when they talk of family planning, it's easy to condemn it and say it's a woman's issue, even within the family and beyond the family. Nobody sees it beyond that. But family planning, it transcends beyond health. Because just like she mentioned by herself, she's standing here, Margaret, because of family planning. And majority of my sisters here, my daughters here, my friends, they're here, including all the men that are here because of family planning. So it's beyond health. Without family planning, we cannot achieve equity. Can you imagine a scenario if you look at the reproductive age group between, let's say, 15 to 49 years? It's almost 34 years. So even with the natural family planning, due to lactational amenorrhea, that is, if guaranteed, let's assume it's guaranteed, that is, you breastfeed for 2 years non-stop, and then the lactational amenorrhea, you know, it's working effectively. It means you will have every 2 years, you will deliver a baby. So in 34 years, I'm not good in mathematics. How many babies will you deliver? I expect the digital design to tell us immediately. 17 children. Yes, I've seen a mother with 17 children. I've seen a mother with 15. I've seen with 13. But that has serious implications on their lives, on the lives of the children that they bring to the world, on the lives of their communities, and the overall socioeconomic development of our country. So this is not what we desire in Nigeria. So as special advisor to the president, we have worked this through, and we have prioritized maternal health as a pillar in the realization of the Renewed Hope Health agenda of the current administration. We cannot achieve health without, and any meaningful development without positioning family planning as an integral part of the journey. So as you all know, Nigeria remains committed to providing access to quality family planning services since 2012. Through the federal government, it has contributed to the basket funding being procured by UNFPA. And we also committed, even before 2030, the initial was 2020 as of that time. We went through that journey, and then we also continue and reiterated our commitment to 2030. And part of what we agreed for 2030 a few years ago is that every subnational government, because the commitment should not only come from the federal government, whatever is coming from the federal government is a catalytic support, to demonstrate it can work. And that has been sustained till today. But much more needs to be done at the subnational level. So what we committed that time was at least 1% of the health budget should be allocated to procurement of family planning commodity. And family planning commodity should not, family planning, when we advocate for it, we should not talk about it in isolation of health. We should talk about it across sectors, across all sectors of development. When you talk about women development, of course, you can't talk of equity without family planning. People call it spacing of the childbirth, spacing of high healthy timing, and spacing of pregnancy, whatever. The goal that we want to achieve is that women should be able to space. Women should be able to plan. Families should be able to plan so that we have a more productive society. So this has been the advocate, and we should look at it beyond orientation. Even when you talk of security today, I always want to relate it to the breakdown and lack of availability to family planning, because when you don't plan, I think there is nowhere that we don't plan. Whatever you want it to succeed, you must plan for it effectively and pursue the implementation. So within the small family unit, it doesn't work if we don't plan it. The planning begins from there, and you must plan and have choices in terms of how many children you want to have, when do you want to have the children, and all that. So this is very critical, but I must also mention that Nigeria has made a lot of progress, though we are not yet there from what we have seen. It has been a very slow progress. So maybe because we've been working around family planning within health sector, now we want to break barriers and work across sectors. So possibly this will give us the desirable result that we want to see, because progress has not been so good. The recent NDHS has shown us that we are still at about 20%. That is all family planning, but less than that when you look at modern contraceptive commodities. So how do we break those barriers? I think those are issues that we need to talk about in this session to see what has worked, what has not worked. How do we increase financing of family planning? Because what we are at the moment is heavily supported and driven by donors. So this is not the way to go, because we have to begin to think out of the box. We have to begin to think of ownership, self-reliance, sustainability. We have to make family planning an integral part of our healthcare delivery, just like we program for other essential commodities. Today, I'm glad to mention that under the Federal Ministry of Health, I was opportune to be the Director of Family Health, where we have ensured that family planning commodities is an integral part of essential drug commodities. It's on the essential drug list at the moment, and I think this is a progress. So more efforts at subnational level to secure. Some states have done well, and we must mention them. Like Lagos State, they've done well, they've sustained, and then some even states like Sokoto, about 8 or 10 states have done well because they have budgetary allocation for family planning that has been released through the basket funding. But we want much more to be done. Most states should also commit resources and ensure that family planning commodities are also procured. But what I have learned over the period, over the years of work that I have done in the space of family planning and the landscape, to say it in that way, is that there's a huge gap, because I recall as early as 2002, there have been a lot of engagement through development partners, UNFP specifically, to rally a lot of religious leaders, do a lot of study tours, take them to countries that we share a lot of, cultures and beliefs and ways of doing things. But they are doing well when you look at their progress in family planning, and that also was closely associated to their development. So what has gone wrong in Nigeria, if you look at look back at 10, 20 years ago, you will find that we've not made much progress. So community participation, community empowerment, the communities must be well informed, they must own it, they must also drive it. So we came up with recently with a project that we have started doing in the high burden states in the country, where we have a high maternal death. And because we know that family planning is a game changer, automatically it reduces. If a woman is not exposed to pregnancy, she has no business dying from pregnancy-related causes or childbirth. Not at all, because you are not pregnant. You only die when you are exposed to pregnancy. So what actually works? Family planning reduces from what we have seen, more than 30% is guaranteed life-saving. So we started engaging with community leaders, religious leaders, discussing the issue in a participatory manner, asking them, do you have maternal death? How many children in a community, the total fertility rate, and we have seen it's about 5 point something, but I can tell you that in the high burden states, it's about 8 and above, some 10, some above that. So trying to get them to come up with solutions, because nobody wants to see women dying. Nobody wants to see a woman in her reproductive life producing 17 children in her lifetime. It's not easy, no matter how rich you are. There are a lot of things that are involved in upbringing of a child. So we started these homegrown solutions for them. And they brought up the issues, because when you talk to them, they will say, oh, family planning is a foreign agenda. But it's not true. From my community, where I come from, a Muslim community, it's not a foreign agenda, it's our own agenda. And our great-grandparents have practiced this for a very long time. And some unsuccessful in majority of cases. So how do we bring them to bridge the gaps, to close the gaps, to increase the use of family planning, and then work across, as I said earlier, barriers to ensure that it is available everywhere? So we need to begin to build champions. We need to have new voices, not only voices of health workers, voices of a community leader, a woman leader in a community, a politician talking about family planning. Different people in the private sectors, not necessarily in the health industry. So that is the only way that people will pause and say, listen, this person is talking about family planning and is not a health provider. So I think it will make more impact, and we are beginning to see acceptance among the general population in communities with high burden maternal death, beginning to talk about family planning, especially the male involvement. We need to empower them, since they are the helm of affairs at the moment, but we are still working very hard to ensure a gender balance, gender equity. There is no way Nigeria can succeed if we continue to work on one leg. And what I said, one leg, is that male dominance, in socioeconomic development, in healthcare service delivery. We must work to ensure equity in positioning women as leaders, especially in the health sector, because this is an industry that the services are mainly provided. Over 70% of services are provided by women. Looking at it across board, from primary health care, tertiary care, to the secondary care to tertiary care. Especially at the primary health care, majority of healthcare providers at that level, almost 90-something%, are women and young people. And then when it comes to the leadership, even at that level, you find that less than 30% are led by women. So the equity issue discussion starts there. We need to deliberately create spaces for women to lead, in that ecosystem. Because when they lead, they are better equipped, better informed. They have the hands-on experience in terms of what should be done to improve the health of women, what should be done to explore potentials for education, because if you have family planning access, you are better equipped. It opens opportunities for you for education. It opens opportunities for you for economic development and all that. So it's not a lecture. I'm just supposed to introduce the topic and then talk briefly about family planning. But it's doable. Nigeria is on a journey of that, and we have demonstrated in the last 2 years continuation of the federal government funding through the basket funding and other additional funding that are currently coming under the Ministry of Health through the National Primary Healthcare Agency, and also through the PVAC, which is the Presidential Initiative on Unlocking the Value Chain. So those are areas we have dedicated, but we also need to do more in individuals, putting in resources. Much more needs to be done at subnational governance also, supporting family planning. Because most of these women are vulnerable, they are not well educated, they're not empowered, they don't have the purchasing power to purchase even family planning commodities. But at the same time, we are also looking out of the usual way of business to see how do we also shape the marketing for family planning beyond the NFPA. And these are also areas that government are thinking as options to reduce the prices of the commodities. At the same time also, we are considering local manufacture of family planning commodities in Nigeria. It's not beyond our capacities in Nigeria. I think it's doable. It's something we can pursue to see that local, because we have a huge population of consumers that we should actually leverage upon to see that we also locally produce commodities in Nigeria and also export those commodities to other African countries and neighboring countries. And that is the only way Nigeria can say we are self-reliant. We are not dependent on donors or donor-driven funding to provide family planning commodities. And we have a sustainable, plan and a journey to attain an equitable access to family planning commodities to all Nigerian women, girls, and also adolescents. So with this, I say thank you so much for the opportunity, and I look forward to the outcome of these discussions to shape the policy direction. Thank you so much.
Thank you so very much, ma'am. Please, let's put our hands together again. So we will put on a video. Please, can you put that on? And while that is on, we would like to quickly just welcome our panelists today. I will start with Dr. Fejiro Chinwe Woko. Please come have your seat as I quickly read through your bio. She's a medical doctor, a wife, mother, pastor, and global health executive. Dr. Fejiro wears many hats in reshaping Nigerian healthcare landscape and with extensive expertise in stakeholders management, strategic development. She serves as the managing director and CEO of the Nigerian Solidarity Support Fund. Can we put it up again for Dr. Fejiro? Okay, moving on next. I'm excited to welcome our dearly beloved Jemima Osunde, who is a Nigerian actress, a model, TV presenter, and licensed physiotherapist. She gained prominence for her role in Layla in the award-winning TV series MTV Sugar, and has since starred in several movies. For the film lovers, I'm sure you know her so well. She's a graduate of physiotherapy from the University of Lagos. Jemima combines a medical profession with a thriving career in Nollywood. Beyond acting, she is an entrepreneur and co-founder of Sana Beauty, a beauty brand launched in 2023. She's also known for advocacy on women's empowerment and authenticity. She continues to inspire a new generation of creatives in Nigeria and across Africa. Let's put our hands together again for Jemima. Let me welcome Ms. Rhoda Robinson. She's the founder and executive director of AC. She's an accomplished international development professional with more than 15 years expertise in designing and executing high-impact strategies and policy intervention in the field of gender equity, financial inclusion for women, RMNCAH, SRH for young people, digital innovation in health and social development. Let's put our hands together again for Rhoda. Last but not the least, Dr. Anas did mention while it's important for us to have male involvement, and even as we deliberately create spaces for women to lead, I'm excited to welcome Yusuf. Yusuf Nu is the senior lead advocacy and country engagement officer, senior lead rather, advocacy and country engagement at FP 2030 Northwest and Central Africa Hub, leading regional and country advocacy and partnership work in 32 countries in the region, and also the focal point in FP 2030 commitment-making countries. Please, let's put our hands together for Yusuf. Thank you so much. We've got just 20 more minutes to go, so I will dive very quickly into our questions. However, there is a video that would play for just 1 minute, 23 seconds. Let's take that, please.
Family planning is the silent driving force behind and advancements we enjoy today.
As a mother and a professional, I understand the importance of being able to plan for the future, and not just for myself, but for my family and the communities around me.
I've seen how family planning doesn't just change lives, it transforms entire societies. It has helped me to balance my family responsibilities and have a sustainable.
Invest in both my career and my children is a privilege, and I don't take that lightly at all. I'm working with FP 2030 to continue supporting the systems that help make that possible at a time that is urgent.
But as you join this campaign, I also want you to do at least two things. Retweet if you're Twitter, do join media platforms about what else family planning can do. Family planning possible, and as they is choice. And women out there is so much more that you can do with your life if you choose family planning.
Raise your voice and share your story with me.
Okay, thank you so much. I would take it up from the last set of statements from our executive director, Dr. Samu. She said the opposite of poverty is choice. And what family planning helps you do is to make choices. And that also just takes me to Jemima, if you don't mind starting up for us. You know, I was trying to read through some of your work, and I did saw a quote that you did made, I think some months ago. You said your biggest fear in life is poverty. I can survive many things, but I can never survive poverty. How can family planning contribute to breaking intergenerational circles of poverty and inequality? What changes have you seen in your community when women, girls, men, and boys have access to family planning?
Thank you. Hello. Hi, everyone. Good afternoon. Thank you all for being here. Thank you for that question. Sometimes I post things and forget that people will see them. So I had written that I had said it in a podcast, that poverty is one of the scariest things in the world. And it ties back to what you have said. Poverty takes away choice from people. I think poverty is one of the most dehumanizing things that anyone can experience. It shows you parts of yourself you probably did not know exist. I'm looking around now and I can say that none of us here is poor, the kind of poverty I'm describing. I'm talking of not knowing where your next meal is coming from. I'm going to reference a movie a series that's just come out because of course I work in film. How many people here have watched To Kill a Monkey? How did you feel after the first 2 episodes? I personally paused and had to say a prayer, like whatever in life that wants to make me live like that man, not know where his next meal is coming from, not be respected by anyone, your wife, your mother-in-law. Every day is a struggle. Just when it seems like something is going to change, you're taken right back to scratch. I watched it and I felt intense hatred for poverty. His life was really tough. You know, he got to the hospital, his wife had just had triplets, and they told him one had died because of some, complications. In the moment, what did he feel? Relief. He was happy. And that's because that's one less mouth to feed. Poverty is a cankerworm, and I really honestly look forward to a time in our country where we will not have as many people having to deal with, that level of want or need. Another part of something that hasn't been added to my bio yet, I've just graduated from the University of Suffolk in the United Kingdom, a master's in public health, because I'm extremely passionate about public health in Nigeria. But that's also because one of the things that poverty attacks is your life, your health. Nigeria, I don't know, this is me, going out of what you said. Nigeria accounts for, I would say, 2.5% of the global population of people. But we account for a quarter, which is about 30% of maternal deaths in the world. About 82,000 women die every year from maternal and obstetric complications. And majority of those women fall below the poverty line. Many of the reasons that they end up dying are preventable. It's not rocket science. It's not something that science hasn't discovered. Very, very, very avoidable things that can be treated, that can be prevented, things that people are dealing with every other day and surviving. But because they're poor, they're not able to access quality health. They're not able to get the medication that they need. There are a lot of women in Nigeria that still don't get antenatal care in pregnancy. And it's just very wild because we shouldn't be having to deal with that. And that's why I say poverty is a big problem, because a lot of these women, or even just the world in general, the country in general, are suffering from things that are very, very avoidable if they had the money.
Thank you so much, Jemima. I really appreciate it. Let's put our hands together for her again. I'm just going to you, Rhoda. In what ways does access to family planning reshape women's and girls' participation in education, the workforce, decision-making spaces? And maybe just to quickly also mention how through AC, you're also setting advocacy strategies that influence budget prioritization of the same family planning that we're talking about. And it's a lot of questions in one. You have just 3 minutes. Please, thank you.
So I'll just pick up on what Dr. Samuel said, that if a woman is not pregnant, she cannot die from maternal, she cannot be affected by maternal mortality. Right? A lot of people do not see how widespread the impact of not being able to choose when to have children has. In a family that would have been able to conveniently cater to 2 children, a husband and a wife, and that family, when the amounts are now 5, you see that they start struggling with things as basic as sending the kids to school, having 3 square meals a day, having health insurance for the children and their parents as well. So when a woman is put in a position where she doesn't have that choice, or the choices that she has is limited to the amount of time she has to spread between taking care of her children, taking care of her family, and then contributing or deciding what to do for herself, you find that a lot of women don't grow past a certain point. And that transitions into her choice for career. It transitions into her choice for how much of an education she wants to pursue at the end of the day. Because she has to now factor in those decisions, because she cannot say that I will stop at 2 children, or I will, my body cannot take more than 3 children at the same time in a relationship. And this goes beyond just being married or with a partner. A lot of times in Haiti, we say family planning is a key component of life planning. Because if you're unable to determine how many children you're going to get, when you're going to start having children, it's very difficult for you to determine what kind of career you're going to have, where to invest the resources, very limited resources that you have in developing yourself as a woman and even contributing to the family that you currently have, or your space, or your community as well. I hope I remember the right questions. And so at Haiti, through our program, we work directly with young people, because we have to start from where you start generating or creating that sense of self, that agency in yourself of being able to say, I want family planning. I know the kind of family planning or the kind of contraceptives that is good for my body, and I know the kind of decisions I want to make going forward. So we start working with young people through our SRHR Impact Health program, that's Sexual and Reproductive Health and Rights, because it's not just about health being available, it's about you understanding your rights and your agents to actually ask for that health and determine when you are not being provided that which is truly your right when it comes to your sexual and reproductive health. So by training young people as champions, as influencers, as activators within their own spaces, using the medium and the language they understand in our current generation, I am Gen Z by association. Let me think. So using that language and helping them understand what it means for their own future, it makes it easier for you to be able to say, okay, we can see where we are going and the available resources that they have.
Thank you so much, Rhoda. Again, let's put hands together, please, thank you. It's very important that women and girls are able to decide for themselves, by themselves, whether, when, and how many children they want to have, and providing them with this information and capacity to do so is critical. So I'll just come to Dr. Fejuru. As a health system strategist, what can you say regarding specific policy levers that are most effective when integrating family planning? Again, we don't want to see it as a standalone. We're talking about it even beyond health. But what opportunities exist for us to be able to integrate it into existing structures and make sure that nobody is left behind? Because every contact at the facility is an opportunity. So how do we make sure that women and girls are able to have the right access, integrating it into the system, the health system? Thank you.
Thank you very much. Good to be here. It's interesting hearing the other speakers talk about this topic. And it's interesting to know that we want to talk about family planning outside of health. And you're talking about integrating policies that are beyond the health sector, right? And there are other sectors in Nigeria that we know that we can easily integrate. But as you were speaking about that, you said to strengthen what happens in the facility. So you're coming back again to health. So we really need to divorce ourselves from our predisposition, which is health. And I say this as a doctor. One sector that can totally work with us, and she mentioned while she was speaking, is the Ministry for Information. And thank God we have an actress, right? Am I correct? Is it actor? Is it actress for both male and female? So it's the Ministry of Information. Sex or making babies was not late in the facility. Preventing that or planning for that would not be late in the facility. It's already late. How did we learn it? We learned it way before we went to the hospital. Right. So the Ministry of Information is one way to target a lot of Nigerians. I'm sure that every Nigerian has a radio, or a TV, or a mobile phone that can access news, information. That's one. And add placement. Number two, it's in information and technology. It's also in movie making. Right? I know that in another country, I don't want to mention because I'm still trying to get visa. You have to be careful these days. You know, when it was the past president, I know that there were criteria to get a movie out. You have to check certain boxes because you're trying to promote a certain agenda, right? And you had to fulfill those criteria. So we saw that Netflix was beginning to bring out a lot of those movies from nowhere. What are we doing with our movie industry? Can we, and not to act one whole series on family planning, of course it's boring. I'm sure the Gen Zs will not watch it, right? But we're saying subtle messaging as you're speaking about couples, as you're speaking about relationship, as the scene is about relationship, about love and all of that. You just put something in there, very subtle. Can we begin to make that a criteria for movie production? Can they get some waiver for that? Those are the ways we can integrate. Another one that is very important and easy is the private pharmaceutical sector, right? While we're talking about access and whether it should be free, still we're talking about it in the facility. We said the basic emergency list or the drug list, that's still facility level. We are still restricting ourselves to the 20% of the population that goes into the facility. But what of the private sector? Right now, the POS is everywhere, right? I don't need to ask anybody where to find the POS. If you just come out of your house, you will find the POS. But if I ask here, where can you find a family planning method? Everybody's still saying maybe highest, the closest would be pharmacy, right? And even the pharmacy, how much do you think you will spend? I'm sure you're not even aware. I was in pharmacy yesterday, I saw someone buy a condom and I was shocked to hear the price because I haven't brought myself to that level of awareness. What am I saying is that we can work with the private pharmaceutical company to do generic drugs that are going to be cheaper, that is beyond the government funding for free services for those that are extremely poor. It's cheaper available. Just windmills are, even the fast-moving consumer goods are producing smaller sachets, making it readily available at the store next to the housing. That's two sectors that we can work with.
Thank you so much, Dr. Pedro. And of course, to the blessed man amongst women, Yusuf would like you to just highlight FP 2030's role in mobilizing partners, aligning commitments, or maybe a little deep dive into the regional funding landscape, as well as accountability mechanism. Again, in 3 minutes, if this is possible. So do the magic.
Okay, thank you very much, and good afternoon, everybody. I know you're holding a lot of questions and calling for 3 minutes. It is important to look at the funding or financing landscape for family planning, because without that, there will be no program or and as such, contraceptives will not reach women, especially those that need the most. So in terms of funding, you need to look at 3 different phases. Before 2020, during the FP 2020 era, 2020 to 2024, and then currently what we're facing. Before 2020, countries made deliberate efforts to create budget lines for family planning, and funded the budget lines, and in most cases provided cash backing to those. Coming to around 2018, 2020, and all the way towards 2024, we witnessed, a dip in terms of what is provided for family planning. Of course, COVID-19 and other economic shocks played a big part in that. And then here we are, 2025, a lot of the overseas domestic assistance is gone. So we are facing a whole new reality, and the funding trend is going to continue to change in the next couple of years. So in the past, we have been providing, that money for family planning. On one hand, country governments through their budgets, and then on the other, which is the biggest, part of the pie, is from donor governments and other overseas domestic assistance. That covers almost 70%. Why am I putting this forward? Is because a whole lot has to change going forward. Countries need to prioritize domestic resource mobilization. Countries need to ring-fence funding for family planning, because it is in all development plans the pivot for countries' national development plans. So why are you putting it forward, and if you're not going to finance it? In the coming years also, we're going to see the importance of blended financing, talking about things like the Global Financing Facility, as well as things that support regional initiatives like the SMED in the Sahel, where they look at demographic dividend as well as women empowerment. For Nigeria, like I said in the beginning, it is important to prioritize domestic resource mobilization, ring-fence funding for family planning, and ensure there is that synergy between Ministry of Health and Ministry of Finance in ensuring that budgets are executed very well. Margaret wants to stop. Yeah. So, lastly, accountability is really key. FP 2030, one of the backbones of this journey from 2020 to 2030 is a strong accountability framework that we have, and it's not just we looking at countries, but it's the entire partnership. FP 2030 looking at countries, looking at CSOs, looking at donors, but they also doing the same. So it's mutual accountability between all partners to ensure that commitments are made and are fulfilled between now and 2030.
Thank you so much, and my apologies for having to speed you up because our time is up. you already have sticky note, please, you can put down just one word that comes to mind or a phrase of what FP family planning made possible. Or if you have questions, we have a booth over there. You can also reach out to us if you have questions for us. Our panelists, I believe, are still very much around and you can maybe meet with them. But as we wrap up, it would be important to get a 30-second commitment from you. I mean, when she was mentioning, there's a lot we can do with the movie industry, I just remember sugar too. I need to know, there's a lot already happening, but what are we committing to moving forward? And more like to say final words. I mean, it can't be your final word. So, just in closing, 30 seconds. So we'll just go around and we'll come back. Yes. Yes, brother, take it. This is the sticky notes to just put down one word.
The HCR organization is already committed to ensuring that young people have access to SRE information and commodities. So we are reinforcing that commitment by opening our arms to say we're willing to partner with anyone who is willing to do the work as well, because it's not just talking, you have to do the work. You have to sow into that agenda as well. So for us, we are going to continue investing in young people to take, to understand their agency and to take decisions that develop them and help them make the right kind of choices.
Thank you, Rhoda. Hands together. Yes, Jemima, please.
First of all, if you haven't watched MTV Sugar, get out. No, but like she mentioned, film is a very, very powerful tool in communicating anything. For example, To Kill a Monkey has shown me that I was never before. MTV Sugar is a great means of communicating about abstinence, sexual health practices, and family planning as well. And I'm very, very happy that I was part of that production. I played on MTV Sugar, a teenager. And one of my scenes was basically a conversation with a health worker that was encouraging and advising her on what family planning technique or method to, take on. So if your parents in the room who are awkward with having sex talk with their kids or whatever, you can watch MTV Sugar with them. Something that I said yesterday to Mr. Clement was that parents that shy away from having the conversation with their children about sex, it doesn't mean they're not going to have sex. So please have the conversation. If you can't have it, sit with them, watch MTV Sugar and other shows that highlight these things. I was at the family planning conference last year, and something the chairman said was, by 2045, we'll be eating each other for dinner. I really hope that doesn't happen. We should all make it our responsibility to attack this. Shout out to FP 2030 and all the other organizations that are set up to tackle this, but I think we should also make it our individual responsibility. The lady that cleans your house, my Tina, for example, has 2 boys, and I told her, if you get pregnant again, you pay me for every child you have. With the salary you earn, I pay her good enough, but it's still a cleaner salary. You shouldn't be having more than that. Make it your responsibility. The people that are around you, your security person, your staff, people you know that financially should not be able to afford that much, help them continue, because it's not just about the child coming to suffer. It's about the quality of life they even get to live. That's one less mouth to feed. So let's make it our responsibility. I'm happy to buy my dinner, condoms for our husband, and contraceptive pills that buy diapers and baby food. So please, everybody, let's make it our collective, individual responsibilities as well to tackle our population in Nigeria.
Thank you so much.
So for NSSF, we have this yearly Youth campaign that is launching. This year's one is launching next week, Monday, September 8th. And this year it's about sex education, the age of one-sided communication. And so that's our commitment, in that we have a platform where we mobilize youth to speak to other youths on this important topic of sex education and how to prevent unwanted pregnancy. Beyond that, what we are also committed to doing is also linking them to services where they could get these family planning services at no cost to them. And it's a nationwide campaign. We feel that that is a move. There's a campaign for 3 months, but we know that there's an election so that they can continue driving this cause. The youth is 70% of our population. If we can be with them, we can be generally. Thank you.
Thank you so much for taking that. And you so.
So in terms of commitments, well, I have two, one personal, the other one professional. For the personal one, last week I got home after about a month out, and my little son looked at me and said, "You're getting old." I told him, "Yeah, it's the work I do." He said, "Leave it." I said, "No, advocating for women and girls' health is in my lifeblood, so it's something that I will continue to do." Professionally at FP 2030, we'll continue to mobilize partners, country governments, CSOs, private sector to ensure that everyone that needs family planning and would want to make that choice on whether, when, and how many children you want to have, we need to do it. So that's my commitment.
Thank you so much. And on this note, we want to say a very big thank you to our panelists. And truly, I think from all that we've had, children are a blessing, but they're a huge responsibility. I think we should prioritize quality over quantity. And we need to stop seeing family planning just as a way of preventing or timely pregnancy, but see it as a way to transform lives. Family planning opens doors to education, career growth, and brighter futures. How has it shaped yours? You can put down how it has shaped yours here. Thank you so much. Please, if you don't mind coming down and we'll take a group photograph. Let's